Hello and welcome to Bite-Sized MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all three parts of the MRCP within the last 5 years and want to help you do the same. We're not associated with any MRCP examination organizations, and the materials covered are by no means an exhaustive list of what can come up in your exam, and indeed are not intended to be used as medical advice. Please refer to your College of Entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic, which is on sepsis under the section of infectious diseases. So, what is sepsis? Sepsis is a systemic deleterious host response to infection. It's usually due to bacterial infections, but may be secondary to other infections such as viruses, parasites, or fungi. In terms of the epidemiology of sepsis, in 2017, about 50 million cases and 11 million sepsis-related deaths was registered, accounting for almost 20% of all global deaths. This is the data from World Health Organization. Half of all global sepsis cases are in children, and 85% of sepsis cases and sepsis-related deaths worldwide are in low and middle-income countries. The highest risk include elderly, very young, pregnant, and multimorbid. So this is a table that hopefully is not coming as a surprise to any of you, as it's something that you should have been taught in medical school. But just as a recap, we broadly divide the different categories of the host response to infection into 4 different categories, starting from SIRS, which is Systemic Inflammatory Response Syndrome, moving up to sepsis, moving up to severe sepsis, and to septic shock. So this is a bit more academic, as in clinical practice, as I'm sure you would know. A lot of the times these get labeled as sepsis, which is not entirely accurate. However, just for the purpose of MRCP, as they can ask you to differentiate between these, SIRS include any 2 of the following: fever more than 38 degrees or less than 36, heart rate of more than 90, respiratory rate of more than 20, white blood cell count of more than 12 or less than 4, and a partial pressure of carbon dioxide of less than 32. Sepsis is basically SIRS plus a confirmed or suspected microbial origin. Severe sepsis is acute organ dysfunction secondary to sepsis, and septic shock is severe sepsis plus hypotension that is not responding to fluid challenges. So as you can see, this is almost like a step-like ladder that gets built up, starting from SIRS and moving up to septic shock. The management of sepsis, again, this is more of a recap, but this can come both in your MRCP written exams as well as your PACES. The management is, as you can remember, septic 6, which is you give 3 and you take 3 things. The 3 things that you give include high flow oxygen, intravenous antibiotic, and intravenous fluid. The 3 things that you take include blood cultures, measurements of lactate, this is normally done through an ABG or a VBG, and also fluid status and urine output measurement. This is normally done in the case of severe infection through catheterization of the patient. Let's do a question now. A 65-year-old man is admitted to ED with a suspected bacterial infection. He is febrile with a temperature of 38.5 and his blood pressure is 90/60. His respiratory rate is 22 per minute and his heart rate is 110. Laboratory test shows a white blood cell count of 15. An arterial blood gas analysis reveals a PCO2 of 30. Based on the Systemic Inflammatory Response Syndrome or SIRS criteria and his clinical presentation, which of the following is the most appropriate next step in the management of this patient? The options include A. Administer high-flow oxygen and reassess in 24 hours. B. Initiate broad-spectrum antibiotic and begin fluid resuscitation. C. Discharge with oral antibiotic and schedule a follow-up in 48 hours. D. Perform a chest x-ray and start antipyretics only. E. Wait for further laboratory results before initiating any treatment. And as you can see, a lot of these options in real life happen all together. That is to say, for instance, giving high flow oxygen or performing a chest x-ray and giving antipyretics. However, the wording of the question is clearly describing someone who is acutely unwell and needs resuscitating there and then. Therefore, the correct option is going to be option B, which is initiating broad spectrum antibiotic and starting fluid resuscitation. A lot of the other things, as I said, such as giving high flow oxygen and also getting a chest x-ray, are accurate. However, rest of the answers, which are reassessing in 24 hours or the only at the end of option D, make them an incorrect option. Option C and E are completely incorrect, as discharging a patient who is hemodynamically challenged is not going to be appropriate, and waiting longer for further tests to become available is also not appropriate. Thanks for listening to this episode of Bite Size MRCP. If you like what you heard today, give us a thumbs up and hit the like and subscribe button to make sure that you don't miss out on our next episode. Let us know in the comments which topics you would like to hear in the future. See you in the next episode.